Thank you, Rich.
As the Senate works to complete its version of a health care bill, a new Associated Press poll suggests support among the American people, as you just heard from Rich, for the idea is perhaps challenged due to concerns over cost.
Will that give some in Congress pause? For that, we're joined by Democratic Representative Eliot Engel of New York and Republican Phil Roe, also a medical doctor of Tennessee. Gentlemen, good to see you both. Thanks for coming in. Dr. Roe, let me go to you first, because there is concern here about not only cost but also choice, whether consumers of health care will have as much choice under the new plan as they do now.
Well, there's no question. If you, David, we've talked about this before, once you have budgeted a certain amount of money to spend on health care, there's nothing you can do but ration care. I mean, that's how you do it. And I don't know whether you saw this new study out on mammograms, which I think is the first step. I was appalled at that we've now changed the recommendations for mammograms to age 50 every 2 years. That means insurance companies and the government won't have to pay as much money. And I think you're going to see more and more and more of this.
Representative Engel, let's attack those two issues first. Number one, the mammograms, and there's a task force. We'll be discussing this more in the program because it caught a lot of people's attention. If that is true, that they're now suggesting that it should be 50 and not 40 for the baseline mammogram tests. Some people look at that and they say, well, there you are. That's an example of the government making all kinds of mistakes in this, and that there's more to come if we have this universal health care bill. I'm sure you disagree, but let's hear it.
Well, I disagree, of course. I think one thing has nothing to do with another. I do agree with my colleague about the mammogram tests. I still stay with the American Cancer Society, which encourages women to take these tests at age 40. I don't agree with age 50 every other year. But we're talking about health care, and we're talking about fundamental health care, and I think that there has been so many lies and mistruths spread about the health care bill that of course the American people are questioning it. Of course they're scared and they're frightened because they've been fed a daily dose of falsehoods. The insurance companies don't want to see what's happened. They're fighting for their lives, and they're throwing all kinds of things out there that are scaring people. So I'm surprised that the support for the bill is as high as it is.
Well, Congressman Poe, the one...